Bismillahirrahmanirrahim. My name is Dr. Noman. My group is here for the examination of skin, hair, and nail. Today I'm going to read the PPT, and Dr. Zainab is the doctor, and Shaham is the patient. They are going to do the work. Okay, first of all, structure of the integumentary system. The skin is the largest organ of the body, comprising of 50% of total body weight. Layers of the skin are epidermis, dermis, and subcutaneous tissue. The epidermal appendages are hair, nails, glands. Two types of skin glands, sweat glands, and sebaceous gland. Sebaceous gland produces sebum, oil secretion. This is the structure of the skin and the glands. So first, the function of the skin, as we know, it provides for protection, sensory perception, fluid balance, temperature regulation, vitamin synthesis, aesthetics, and homeostasis. So terminologies we are going to examine in the skin. So first of all, we have to see the macules, patches, papules, plaque, wheal, nodules, vesicle, bulla, pustules, and cyst. So Dr. Zainab, can you please check these? Dr. Shaham.
Assalamu alaikum. My name is Dr. Zainab Zahir. I'm here for your examination of your skin, hair, and nail. So first, I ask you about your name, your age.
22.
Okay. So your occupation.
Student.
Are you married or single?
Single.
Okay. Your address.
Kitchen.
Okay. So before starting our examination, do you have any questions?
No.
Okay. So do you have any pain in your body?
No.
Okay. So I have a permission to touch your skin.
Okay.
Okay. So first, before examination, I want to ask you a few questions. Do you have any history of skin cancer?
No.
Okay. So do you use sunscreen when you go out?
No.
Okay. So before starting the examination, it is important to tell you that sunscreen is very important because it prevents us from the skin cancer. Okay. So first, I need to examine your hand. So can you please move your sleeve back? Okay, both hands. And also the temperature, I need to check. Your skin is warm, your temperature is okay, and your skin is smooth, and the color of the skin is good. So there is no sign of cyanosis and pallor. We need to check. And also by the visual inspection of your face, there is no sign of cyanosis. Okay.
Okay, after seeing the primary skin lesions, now we have to see the secondary skin lesions. The secondary skin lesions can be scars, fibrous replacement of the lost skin structures. These can be fissures, linear breaks in the skin surfaces not related to the trauma, and excoriations, lesions resulting from the scratching or excessive rubbing of the skin, and erosions, loss of epidermal layers, usually not extending into dermis or subcutaneous layers. Then skin tumors and growth, such as moles and nails. So, Dr. Zainab, can you please check the secondary lesions of the patient? Just like the primary.
Okay. So, can you tell me, because we don't have the curtains here, so I need to ask you, do you have any mole which is larger in size?
No.
Like you can examine like a pea size or a larger like eraser?
No.
Okay. Or any sign of scar on your body?
No.
Okay. So by examining your face, there is no mole on the face, which is also normal. And as you said, there is no mole abnormality on your body. So,
Okay, now I'm going to give you the examples of the lesions we have to see. These are the macules, patches, flat circumscribed, discolored, uh, less than 1 centimeter in diameter. Then patches, flat, circumscribed, discolored, more than 1 centimeter in diameter. Then papule, just like now, plaque, wheals, these are the nodules, vesicles, pustules, bulla, and the cyst. Now the secondary lesions like scar, these are the secondary lesions, scars, fibrous scars, fissures, these are excoriations and erosions. Okay, the moles and the nave. These normal variants can be macular or papular and distributed anywhere. Congenital neve, birthmark, exist from birth. It can be exist from birth or acquired neve, usually develop in childhood as adolescence. So objective type, inspect and palpate the skin. By palpating the skin, we have to check, first of all, we have to check the color. The skin color varies from body part to body part and from person to person. Widespread color change, like we have to see the erythema, cyanosis, pallor, and jaundice. So Dr. Zainab, can you please check it again for skin color?
As I checked before, a patient, Dr. Shaham, he has no sign of jaundice and no sign of pallor and no sign of cyanosis. So he is completely normal in this case. So we don't need to examine further.
Okay. Now we have, what are the danger signs? So danger signs are the A, B, C, D, E, double E. So abnormal characteristics of the pigmented lesions. What are the abnormal characteristics of the pigmented lesions? These are asymmetry of a pigmented lesions, as she told earlier, Dr. Zainab. Border irregularity, we have to check it. Color variation and the diameter greater than 6 millimeter, elevation and enlargement. So we have to check this. These are the danger signs. So this is the table we have to check for A, B, C, D and E. First of all, asymmetry, then we have to see the borders, the color, diameter and evolution. Palpation of a temperature, so we have to check the temperature of the skin, palpate of the skin with dorsum of the hand. Okay, temperature of the skin depend on the amount of blood circulating through the dermis. Generalized warmth, local warmth, inflammation, can be inflammation, coolness, it can be hypothyroidism, frostbite, hypothermia, shock, low or cardiac output. Assessment of the skin in critical point in some conditions such as after cast application or after vascular surgery. So can you please check the temperature of the patient? So you have checked already? Okay. So after checking the temperature, now we have to check the moisture of the skin. Skin is normally smooth and dry. As you know, skin folds, for example, axilla are normally moist. In presence of lesions or ooze fluid, must wear gloves to prevent exposure to infectious drainages. Moisture indicates degree of silent hydration and condition of the outer lipid layer of the skin surfaces. Dry cirrhosis, vitamin A deficiency and mesoderma can lead to this type of dry, and oily skin can be lead by acne. Palpation of the texture. Texture of the skin normally smooth, soft and flexible. If any abnormalities in texture found, you must ask the client if he ever exposed to any recent injury to the skin. What nurses do, nurses determines whether the client's skin is smooth or rough, thin or thick, tight or supple, flexible. Very soft, thyrotoxicosis, it can be thyrotoxicosis. If the skin is very tight, then scleroderma or hard skin. Rough, hypothyroidism. Can you please check it, the texture of the skin?
Uh, as we checked before, the skin of the palm and the sole are the thick skin, while the rest of the skin on the body is thin. So, as I checked before, skin texture is smooth and normal. And we can also check the turgor mobility of the skin by doing a pinch test. And this, I need to pinch his skin. If the skin moves back to his normal position rapidly, then it's normal. And if it takes time, then it is due to dehydration or any other cause. So I need to do this test here. So I'm pinching his skin, and when I leave it, if it goes back, then it is normal. And if it is take time, then the turgor and mobility of the skin is not okay. So as you can see, skin goes back to normal in a few seconds. So it is completely normal.
Okay. Okay, I see already told you about the trigger, so we don't need to go through it. So inspection and palpation of the lesions. So as I told you, we have to see the color, the elevation, is it flat, raised and pedunculated, pattern or shape, for example, annular or grooved or linear, size is in centimeter. Use a ruler, we have to use the ruler to check the size. Location and distribution on body, generalized or localized, is it any exudate, not its color or odor. Okay, pressure ulcers, bed sores, and decubitus ulcers are localized injuries or to the skin and underlying tissue that usually occur over a body prominences as a result of pressure or pressure in combination with shear and friction. The most common sites of the skin overlying the sacrum, coccyx, heels, or the hips. So can you please check it? We don't have blindfolds, so you can see it.
As in this case, we don't have blindfold, so we will avoid, and the patient is also wearing shoes, so we can't do it here.
Okay. So these are the pressure sores, ulcers. Okay, now we have to inspect for the nails. So first of all, in nails we have to see the shape and the contour. We have to check clubbing, congenital. Is it congenital? It can be congenital or chronic. So it's like carbon dioxide retention due to spooning, concave curves, iron deficiency, transverse grooves, and nutritional deficiency, and longitudinal grooves. Then we have to see the capillary refill time. So can you please check it? The nails.
Okay. So can you please place your finger like this? Firstly, we need to see the structure of the nail bed. It should be pink, and as in case of our patient Shaham, his nail bed is pink, so it is normal. There is no sign of cyanosis, which is a bluish discoloration, and also we can check the capillary refill time. If it is less than 2 seconds, then it is normal. So we need to press, and then we need to leave, and then it is okay in this case. So the texture of the nail should not be spongy, it should be firm, so then it is in the normal case. So it is okay in Mr. Shaham.
Okay, so this slide is what shaded on the nail inspection. So now hair assessment inspection. In hair is what we have to see. We have to see the color, the textures of the hair, distribution, male versus male. Alopecia depend on the distribution of the gender, lesions, hygiene, and parasites. So can you please do the inspection of the hairs?
Okay, so am I allowed to touch your hair?
Yes.
Okay. So in examination of hair, we need to see the texture of hair, and also by moving the hair from one place to another to see any sign of alopecia, which is the baldness, or as our patient is a male patient, so we need to check, because in some male there is a male pattern baldness, which is commonly seen in all patients. Like in some male, it is normal, and in our patient his hair color is black and there is some gray hair, which is also normal in some patient. So his hair is clean. So hygiene, we also need to tell the patient to maintain the level of hygiene for his own benefit, and there is no sign of dandruff in his hair, so his hair is normal.
Okay, thank you. So this is, this is the slide. So we should check for alopecia as he told. Alopecia hirsutism can lead to this kind of androgenic hormone. In a female patient can causes masculine changes including hair in male distribution patterns. So this is all from the group D.